dari Masyarakat Islam, dari Staffing Gas, Wecare, dari Wecare, Staffing Gas. Ini ada. Warahmatullahi wabarakatuh. Selamat pagi, salam sejahtera yang hormat Bapak Wali Kota Bandung. Hari ini dari jajaran kesehatan melakukan mungkin audiensi dan juga memperkenalkan ada tamu. Yang pertama adalah dari Wecare, Pak. Wecare itu adalah grup yang membantu kami bagi pasien-pasien yang membutuhkan pembiayaan di rumah sakit. Jadi kita based on hospital dan kita tahu kita harus masuk dulu ke sistem asuransi. Jadi kalau miskin itu sudah dijamin. Nah ini masalahnya ada yang belum ikut BPJS atau miskin belum terdata SKM. Jadi ini bagi kelompok tersebut. Maka teman-teman inilah yang memfasilitasi apabila ada masalah pembayaran dengan rumah sakit. Nanti mungkin akan lebih diceritakan lebih detail untuk kasus-kasus tersebut sehingga tepat sasaran dan jangan sampai pesan orang mengikuti jaminan kesehatan menjadi hilang. Karena itunya tetap orang harus memiliki jaminan kesehatan. Kemudian yang kedua adalah dari Rumah Sakit Al-Islam dan Dokter Dadang ini menindaklanjuti sambutan atau arahan Bapak tentang kunjungan dokter ke rumah. Jadi mungkin nanti Dokter Dadang yang akan memberikan penjelasan bahwa untuk kasus seperti apa memperkuat program puskesmas yang sudah ada. Puskesmas juga sudah ada sebetulnya dengan perkesmas, tapi berbasisnya care, jadi merawat, not to cure. Kalau ini dokter berarti ada cure-nya. Nah ini bedanya. Yang ketiga adalah dari all the student from Medicine Faculty of University of California. Jadi they have a field visit in Bandung, in Dinas and Puskesmas, and already make an activity in our office and also in Puskesmas. Maybe Bima will introduce your friend or team and also what is your activity.
Terima kasih. Thank you for coming. Welcome to the city of Bandung. Today we have 3 agendas because all related to healthcare. Number 1 is from Wecare. Number 2 is from the hospital. Wecare is a public initiative to assist poor people who are not already in the insurance. Yeah. Sometimes we have in Bandung we have a system for poor people is free. When there's a problem, we try to have an emergency way raising funds. Yeah, that's the Wecare system. Number 2, we are also trying to find, maybe you can also give some ideas, is to have what we call visiting doctor programs. Instead of poor people stressfully visiting big hospital, sometimes rejected because the hospital is too procedure and sometimes it's full. We try to visit in emergency system to see that not everything need to be taken care of in the hospital. Indonesia is still on progress. It's far from perfect. That's why, as a mayor, I need more ideas, more contribution from all related in healthcare. The city is 2.5 million population. And from 2.5 population, we have 50,000 per families in the city. As the hospital is always full. I have a case, it's very sad for me. Last month, one of my citizens died because he got rejected by hospital. The hospital said it's full, you need to come back, and while waiting, he died. So it's very bad. So I think what we need is, while we reform the whole system, there is some sort of loophole along the process that we try to fix, either by public engagement, either by, so that's basically the conditions. But in general, our human development index in health is higher than the education standard. Yeah. And also in Bandung, I'll tell you the statistic. That's why when we fix the city, one of them is we use collaborations as a culture. As I said, we still have a situation of poor hygiene and nutrition to the children, to the babies. So there is an initiative. We deliver healthy food by motorbikes. We won this award for healthcare innovation. So what we do is it's a public initiative again by people. We identify the poor mother who has a baby. Sometimes because it's so poor, they don't really care about the nutrition for the baby, right? They just feed the baby whatever they have. So now we have a food delivery system. We cook the food in public also kitchen with a very healthy nutrition food. We grow our own vegetables, yeah, so from our urban farming, which is now become a mandatory policy. So the food delivery to the malnutritious baby is also we exercise creating the food also from our urban farm. So I think that's just a brief intro, yeah. Just a brief intro what I did. What I've been doing the last 2 years is really changing the civilization of. Last point before we start Wecare is the value of collaborations. Yeah? I always believe the less the state interfere, the better the nation. It means the society can take care of their own problems. Yeah? That's what my dream of civil society. When the society has a problem, the society heals itself with their own social feeling and belief. That's what I call collaboration. To that I conclude, and now we start Wecare. So you wait the December response.
It's basically a crowdfunding platform dedicated to help people or patients to pay medical bills. We start out actually not with the passion for Bandung, but from the eastern part of Indonesia, rural area. So biasanya yang tidak terjangkau fasilitas yang memadai itu mereka tidak punya BPJS. Kalaupun punya, even though they have government insurance, they are not facilitated with adequate healthcare facilities. So the ratio between the adequate healthcare facilities and the society is the gap is very high. So and kita potensinya besar sekali karena lebih dari 56% masyarakat Indonesia adalah kelas menengah, which is very easy for them to spend some money for good causes. But sometimes, many times, they don't have access for that. So they want to do good, but they don't have like simple access. They don't have accountable platforms that they can see the impact directly. Gitu.
www.wecare.id. There's a lot of profile patients you can choose based on their story, based on their something that touching your empathy, and then you can donate as little as $2.5 US. Donating for a cause or patients you really like to donate and touching your empathy. So we have stories and details about how much is the funding for the medical treatment of the patients and so on. So just go over to our website. So to get involved in Wecare.id, there are 3 main ways. First is to be a donator or a donor. So that is the first that I mentioned to you guys. So you just go over to your website and you just look at the patients that you might want to donate, starting from 25,000 rupiah or $2.5 US to be helped, but they have this kind of burden by the fund. You can sign up to our website, sign up your profile, and then sign up patient's profile, and then we're getting it to our website, and then you can just go over and see how's the crowdfunding, and then we can just transfer the fund to you. 55 fully funded patients from all over Indonesia. So I would say all over Indonesia because we have patients from Sumatra up until the east of Indonesia in Maluku. We have collected around 675 million rupiah, which is around 60,000, 60K.
Jadi ketika kapasitas tidak mencukupi, kita sudah melaksanakan program pasien yang pasca waktu dirawat lagi di rumah dengan indikasi tertentu. Dalam perkembangannya, permintaan untuk pick up pasien itu banyak. Sehingga akhirnya dikembangkan ada kunjungan ke rumah ketika ada telepon, kita mengundang pasien datang ke sana dokter kompleks namanya, dan di assessment. Dan sebenarnya konsep ini seperti konsep response management, response management in emergency case. Jadi memang ada assessment awal untuk diagnosa, maka setelah itu dia akan putuskan apakah harus dibalikkan ke rumah sakit atau di. Maksud saya bahwa kita sudah ada SPGT, sistem penanganan darurat terpadu. Nah, kalau kita punya aplikasi panic button untuk yang sakit yang tidak bisa diakses, kemudian terkoneksi pada itu, membernya misalkan dokter yang bisa latih dengan standar tertentu, maka dia akan datang ke situ, dia akan assessment. Nah, nanti ada konsultan spesialis yang akan memberikan assessment. Oh, ini bisa dirawat, ini bisa di situ. Ketika harus dirawat, balik lagi SPDT. Apakah ambulan yang bisa dijemput itu? Nanti ke rumah sakit mana yang dijemput? Mungkin untuk yang panic button nanti kasih dokter tadi bisa free, karena mungkin untuk volunteer saja. Jadi ketika ambulan yang menjemput, itu bisa pakai BPJS, bisa pakai rumah sakit yang setempat. Atau kalaupun rumah sakit yang disebut ambulan bukan rumah sakit yang dituju, itu adalah dalam aturan yang sudah ada. Kalau home care biasa kan itu perawat, ya, pure care saja. Kemudian kita karena memang harus assessment dokter, maka di sana melakukan communicate, clinic communicate, ada mediknya gitu. Konsepnya response management itu ketika ada permintaan dokter yang datang, bukan perawat. Dokter yang datang di assessment, ada aturan standarisasi dunia yang sudah diketahui. Maka dia konsul lagi. Ya, saya baru mengembangkan, kita baru terbatas di lingkungan sekitar saja. Nah, saya coba kembangkan di yang swasta, private, dan bisa mandiri seperti itu. Tapi bukan home care, home care. Karena kalau home care yang saya itu adalah hanya perawatan luka, ganti NGT, ganti selang dan sebagainya. Ini home care karena memang biasanya adalah spesialis yang kita hadir. Saya kira gambaran silakan begitu.
Jadi sifatnya untuk yang emergency.
Ya, ada dua, ada emergency case, ada yang non emergency. Kalau emergency case tadi mungkin Alisa mengembangkan tadi ada motor yang namanya emergency response SI. Nah, kalau yang selamat dulu itu ada yang non emergency. Ya, ternyata meningkat kebutuhan untuk emergency case itu.
Ini menambahkan Pak, mungkin ada dua nih, jadi panic button masyarakat pencet, nanti ada dokter terdekat datang, dia melakukan assessment apakah ini memang emergency atau non emergency. Kalau emergency dia stabilisasikan dulu, dia diberangkatkan ke rumah sakit dengan sistem SPGT yang sudah kita ada, ambulan gratis dan sebagainya. Kemudian selanjutnya dikonsulkan ke dokter spesialis dan ada penanganan. Jadi sebetulnya model-modelnya seperti itu. Atau yang kedua adalah yang memang pasiennya rumah sakit, pasien rumah sakit yang telah pulang, kemudian karena sudah bisa ditangani di rumah, maka dokter dan rumah sakit itu dia ada.
Oke. Jadi untuk yang Wecare, saya kira kita bisa segera mengumumkan ke publik Bandung ya. Itu saya minta hari ini aja kira-kira. For all the presentations, as you can see, every civilization is very unique. You cannot generalize places in this lovely earth in the one perspective. I used to live in Queens, working in Manhattan. My son was born in the Amherst Hospital in Queens. That was one of my lowest point. Why? Because I was fired as an architect. Not because I was not performing, it's because my visa was the employer of mine forget to extend my working visa while my wife pregnant 8 months. So in Amherst experience as an architect. Before 2013, I decided to take over the city. It was in a bad shape, physically and bureaucracy-wise. But now we see progress and focus more on this poor side of society. This poor side of society lives in very dense, typical Asian metropolitan, and that creates an issue in healthcare services. The road is too narrow, the gangway is very tight. That's why we are thinking also to combine with the initiative from the Islamic Hospital to deliver visiting doctors program, voluntarily. So it's, we are building apps also. We call it a panic button app. So we have already panic button app. So in Bandung, in the case of emergency, you don't have to dial 911. You just, because sometimes you're too panic to call, right? You just press your screen, and the screen will sound an alarm in my command center. In the command center, the police who is stationed will dispatch the police patrol within the radius of the location of the emergency. Why? Everybody in Bandung has a mobile phone. Indonesia population 250 million, number of mobile phone 300 million. So this is the country where number of mobile phone of number of population. Just the panic button you download from Play Store, you get the sound, then the police will dispatch. So within the same logic, we will use the panic button for emergency healthcare. But since the slum area is difficult to maneuver by car, that's why we are based on problems. So that's why when you back in US, in the long term, please consider Bandung as your second home, okay? Meaning, every time you have a new research or new things that wants to experiment, Bandung is more than happy to welcome your invention, your concept. As again, for us, humanity is beyond borders. So if you feel Bandung is the right home or city for you to extend your cause and extend your kindness, please contact us. For us, is to have all kind of approach. That's why I used to live in US, now live in my hometown, so I know the difference. I implement some that I can, but not all. Especially in this poor family in Islam. I'm happy to say also, I met investment healthcare company from US. They are from the Pittsburgh Hospital. Yes, that organization. I met the UPMC in Boston last month. I went to Boston, and they really invest in Bandung. And I'm happy. They told me that Bandung now selected Bu Ayani as a 5th city in the world to have a cancer research hospital built by UPMC money. We would like to have Bandung to become a better city in their own unique way. So for that, I conclude, and again, thank you for the wonderful meeting, and good luck to your future career and endeavors. Hatur nuhun, Bandung juara, and stay healthy, ya. Terima kasih. Assalamualaikum warahmatullahi wabarakatuh.
Oh, itu apa sih pringgiling tadi? Pringgiling. Like this? Yeah? Yeah.
This is Persil.
Halo, saya Irvine wali kota Bandung. I support Wecare ID menuju Bandung yang sehat dan merakyat.
Thank you, Pak.
Oh, yang di web ya.